If you get a crunching, cracking, or grinding sound in your knees, you may wonder what it is, if it's harmful, and how do you get it to stop? I'll answer all of those questions in this video. Now, first of all, what is a crunching, cracking, or grinding sound in your knee? There are several different things that can cause that. Sometimes people describe that as like a bowl of Rice Krispies when they first get up in the morning. And if you just get that when you first get up, or you get it every now and then, it's probably just air being released from your joint capsule. Kind of like when you pop your knuckles, you get that once or twice and then it goes away. And in that case, it's probably just the air being released. However, there's another situation where maybe every time you squat or every time you go up or down stairs, you hear this sort of persistent grinding, crunching sound, and that's something a little bit different. Often it's due to two joint surfaces rubbing together in ways that they shouldn't. Usually that's in your kneecap and thigh joint or patellofemoral joint, where either the kneecap is being compressed too much up against your thigh bone, or it's tracking to the outside. You have a little groove that your kneecap should normally move up and down in, but if the kneecap moves too far to one side or the other, but typically more the outside, you can get rubbing along that outside of the groove, which can give you that crunching or grinding sound. Now, is that serious? Most healthcare professionals will tell you that if it doesn't hurt, that crunching or grinding sound is nothing to worry about. And largely, I would say that's probably for the most part true, but it's not normal per se. So although if you don't have pain, you probably don't need to worry about it immediately, it probably is an indication that something's not working properly mechanically, and you should pay attention to it and probably try to fix it so it doesn't become a problem further down the road. But just hearing that sound once or twice or every now and then is not going to harm you in the immediate term. So the big question you probably have is, how do I get rid of that crunching, cracking, or grinding sound? Well, again, if you just have it in the first thing in the morning or when you first stand up, you get a few pops or cracks and then it goes away. It's really absolutely nothing to worry about whatsoever. Again, it's just like cracking your knuckles. However, if you get that persistent pain that's predictable and repeated no matter how many times you do it, for example, you do squats and you hear crunch, 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 or you go downstairs and you hear crunch, crunch, crunch every time you go down, that probably means that most likely your kneecaps aren't moving properly. Now you can get it at the tibiofemoral joint as well, the joint between your lower leg bone, your tibia, and your upper leg bone, your femur, but most commonly it is in the kneecap or patellofemoral joint. So how do you stop that problem? Well, largely there are two things that cause it. Either too much global compression, meaning your quadriceps are pushing the kneecap up against your thigh bone, or that tracking to the outside, which has more to do with the inward-outward motion of your knee. So first, the global compression. Your kneecap sits inside your quadricep muscle, and so as you bend your knee, the further down you go, the stiffer that quadricep muscle gets stretched over the knee, and the more compression it puts of the kneecap on the thigh bone. Now, if you have chondromalacia patella, or if you have kneecap arthritis, kind of different variations of the same thing, where you have wearing down of the cartilage, the more compressed you get sort of that grinding sound like two pieces of sandpaper rubbing on one another. And again, if it doesn't hurt, probably not serious to worry about in the immediate term, but you probably do want to stop it. Now, in order to stop that crunching, you need to improve the ability of the thigh muscles to lengthen as you're bending, known as eccentric lengthening. And then you also need to not use the quadriceps quite so much. Probably the easiest way to stop that crunching sound is to sit back more on your heels when you're doing an activity such as squatting. Squatting or lunging or anything where you're bending your knee like that uses both a combination of your quadricep muscles as well as your glute muscles. And if you're using a lot of quadricep force, that compresses the kneecap more up against the thigh bone and can give you that grinding or crunching sound. Now, when you put your weight more on your toes, for example, squatting or lunging, that creates more compression of the kneecap and will give you that crunching sound. But if you keep your weight more on your heel, for example, when you're doing a lunge, sitting more back with the weight on the heel, or when you're squatting, sitting backwards, kind of sitting your hips back like that as you're going down, that'll put more weight on your heels, which will make you use your glutes more and your quadriceps less. Now, what about the other issue, the side-to-side problem? When you're squatting, if your knees go inwards, the thigh bones or femurs track inwards, which relatively makes the patella track outwards. And that can cause some grinding along the outer edges of the patellofemoral groove. So think about turning your knees out slightly, keeping the weight a little more on the outer sides of your feet. Now, if you think about your feet, you're actually going to kind of dome your arch or scrunch your toes slightly inside your shoes. And that'll help support you in this outward position and keep everything lined up to where that kneecap is moving more smoothly. So turn the knees out and then squat down and go through just a range that you feel comfortable going, and in this case, that you don't hear any noise. And as you learn the movement pattern better, you can probably get deeper and deeper down without getting that crunching or cracking. Now, the same thing applies if you're doing something like a lunge. You want to keep your hip, knee, and toe in alignment so your knee's not going inwards, and find the angle to where you can go down without getting that crunching or cracking sound. And you may have to experiment a little bit with how far inwards or how far outwards you go. But once you find that correct angle, just progress through that movement pattern and try to get deeper and deeper while keeping your knee from crunching or grinding. Now, you may also note that if you bend or straighten your knee, that you hear that crunching or grinding, even if you're not putting weight on it. And sometimes if you straighten your knee out and you get that crunching, if you turn outwards just a little bit, that'll help position the kneecap more relatively centered in the groove, and you can go back and forth, and oftentimes that will decrease the sound as well. Now, what if you get crunching or cracking or grinding in your knee when you're going downstairs? Going downstairs is a very common time when people experience cracking or grinding in their knee, because as you're going upstairs or as you're squatting, you can sit back a little bit more and put your weight a little bit more through your heel. However, when you're going downstairs, you really need to put your weight a little bit more through your toes in order to progress forward down onto the next step. And that requires more eccentric lengthening of your quadriceps in order to prevent compression of your kneecap on your thigh bone. So to learn how to improve the eccentric lengthening of your quadriceps and stop that grinding and pain of your kneecaps when you're going downstairs, check out this video over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.